So our in that miscellaneous agent, this is the last subunit, nothing but the poison as well as the antidotes. If we finish this subunit, nothing but the poison and the antidotes, then our miscellaneous agents topics will get finished. So what about the poison and the antidotes? All of you audible?
Yes,
Yes,
ma'am.
ma'am.
Yes, ma'am.
Okay, so we have to start we are going to start about the poison as well as the antidotes. So what is mean by the poison? All of you know what is the poison and which agents are used for the treatment of the poison. So what is mean by the poison? Poison is a harmful substance. When it comes contact with our living organism, it produces the abnormal effects on the human health as well as on a living organisms. That is nothing but the poisons. Very simple. What is mean by the poison? It is a harmful substance. When it comes contact with a living organism, it produces the abnormal effects on your health. Nothing but the poison. So poison is nothing but the vish. Marathi मध्ये it is called as a vish. So that the it is a harmful substance, it is a harmful agent. जेव्हा तो आपल्या कॉन्टॅक्ट मध्ये येतो, when it comes contact with the living organisms on your, it produces what they will do, काय करतात ते, it will produces the abnormal effects on your health. That is called as a poison. So which are the sources, which agents are responsible for causing the poison? Nothing but the some chemical toxins, then insecticides, pesticides, microorganisms, and the snake venoms. These are the some agents, not everyone, not everything. So these are the some agents which are responsible as well as which are causing the poisons in your body. First one is the chemical toxins, nothing but the rasainik khate as well as the rasainik agents. Next one is the insecticides as well as the pesticides. See, insecticides as well as the pesticides are, these are insecticides are mainly used for in a farm purpose. So in that, on the crops they will spread insecticides as well as the pesticides to prevent from these crops to get destruct. So for that purpose mainly insecticides as well as the pesticides are used. Then some microorganisms also responsible for causing the poison as well as the snake venoms, nothing but the bite of snake. So sapaचं विष पण, whenever that the snake will bite to the human, what they will do, someone everyone will say that they are producing the poison in your body. So chemical toxins, insecticides, pesticides, microorganisms, and the snake venoms. आपल्या घरी पण बघा, आपल्याकडं कॉक्रोच ॲज वेल ॲज द कॉक्रोच होतात, तेव्हा आपण काय ते काहीतरी वापरतात बघा. So that act as a insecticides. In that also they will write. So it is dangerous for the health. In a cross form, they are saying that it is dangerous to the health. So these are nothing but the insecticides which are produces the poison, and they are going to produce very serious effect on your body. So these are the some sources which are responsible for causing the poison in your body. So sources are nothing but the chemical toxins, insecticides, then pesticides, some microorganisms, and the snake venoms. These are the sources which are going to produce the poison or which causes the poison. So another definition of the poison, what is the another definition? Any substance that is harmful to your body or any substance that causes disturbances in your organism, that is called as a poison. कधी, when you might swallow it, inhale it, inject it, or absorb through the skin. कधी जेव्हा तुम्ही जर ते पिला असाल तर, म्हणजे स्वॅलो तुम्ही जर गिळाला असाल तर, किंवा इनहेल केला असेल तर, किंवा तुम्हाला इंजेक्शनद्वारे दिलं असेल तर, किंवा तुमच्या स्किनवर ॲब्सॉर्ब झाले असेल तर, तेव्हा काय करतात, दे कॅन प्रोड्युसेस द हार्मफुल इफेक्ट इन युअर बॉडी ॲज वेल ॲज दे कॉज द डिस्टर्बन्सेस इन युअर ऑर्गॅन, डिस्टर्बन्सेस in your body. So that is nothing but the poisonous substances. Any substance, मग तू कुठलाही substance असो, any substance that is harmful to your body or any substance that causes the disturbances You might swallow it, inhale it, inject it, or absorb through the skin. That is nothing but the poisonous agents as well as the poisonous substances. Keep in mind very simple what is the poisons. These are the agents which are responsible for causing the poison in your body. Otherwise, poison is a harmful substance which produces the abnormal effects when it comes contact with your living organism. पॉइझन म्हणजे काय असा सबस्टन्स जो असा विषारी पदार्थ जेव्हा तुमच्या बॉडीच्या कॉन्टॅक्टमध्ये येतो तेव्हा तो काय करतो तुमच्या बॉडीवर साईड इफेक्ट ऑकर करतो. It may be serious or it may be normal. Sometimes it causes the death also if it will get the serious poisoning. So in that nothing but the poison. Now which drugs are involved in the poisoning? Not only all the chemical toxins, insecticides, pesticides are responsible for producing the poison in your body, but some our pharmaceutical drugs are also involved in causing the poison. So which are nothing but the aspirin, paracetamol, benzodiazepines, selective serotonin reuptake inhibitors, anticonvulsants, and the other analgesic as well as the non-steroidal anti-inflammatory drugs. Aspirin. See, all of you know aspirin. So, aspirin, if you will take the overdose of the aspirins, so you will get the poisoning. For that purpose, act as an antidote. So, which are the pharmaceutical drugs causes the poisoning? पण कधी cause होतात? If you will take the overdose of the drug as per require. So as per than the requirement, if you will take the more dose as per तुम्ही जेव्हा प्रिस्क्राईब केले त्याच्यापेक्षा जर तुम्ही जास्त डोस घेतला सो व्हॉट दे विल कॉज द पॉइझनिंग. विच ड्रग्ज आर रिस्पॉन्सिबल फॉर कॉजिंग द पॉइझन? नथिंग बट द aspirin, paracetamol, benzodiazepines, selective serotonin reuptake inhibitors, anticonvulsants, and the non-steroidal anti-inflammatory drugs as well as the analgesic. Analgesic nothing but the pain reliever drugs. So paracetamol act as an antipyretic agent which is used for reducing the fever. So nothing but the antipyretic agents. If you will take the more or the overdose of the paracetamol directly it causes the काय होतं इट कॉजेस इन टू द कशावर होतो परिणाम पॅरासिटामॉल जर आपण जास्त घेतलं तर हार्टवर का किडनीवर?
Kidneyवर.
Yes, it causes the directly effect on a kidney. So if you will take the more overdose of the paracetamol, what they will cause? They will cause the poisoning also, and they can directly affect in your kidney part. So for for that purpose you have to avoid the overdose of your drug. Whatever doctor prescribed that much only you have to take. If you will take the overdose of the drugs, that drugs also produces the poison in your body. Then benzodiazepines also nothing but the sedative as well as the hypnotic agents. Those are the agents which produces the sleep, nothing but the sedative and the hypnotics also. So if you will take the more sedative as well as the hypnotics drugs, these are also very harmful to your body. They can cause the poisoning. Then anticonvulsant nothing but the epileptic drug, epilepsy drugs. If you will take the more epilepsy drug, then what they will do, they are also causing the serious effect on your health. And painkiller also, if you will take the more painkiller also directly affect in your body and they are going to produce the poison in your body. So these are the drugs which are involved in the poisoning. Though above are the sources, but these are also drugs which are responsible for causing the poison. But when if you are taking the overdose of the drug, this is the all about the poison. Poison म्हणजे काय? Any harmful substance which are comes to the contact with our living organism. काय होतं मग कॉन्टॅक्ट झाल्यानंतर they are going to produce the abnormal effects on health. Abnormal म्हणजेच काय? Rather than normal, they are going to produce the abnormal effect on your health. Sometimes it causes the death also, serious effect, that is the severe effect of your body. So produces the abnormal effects on your health, nothing but the poison, nothing but the chemical toxins, insecticides, pesticides. See, whatever you are using the farming purpose, insecticides as well as the pesticides, these are very dangerous. And see, they in their bottle also they can already wrote what they wrote, that the dangerous for the health, so do not take internally, just you have to use for the farming purpose. Then pesticides also, whatever we are using in a home, pest controller, that are also very harmful to your body. In that also they can write in a dangerous in a red color, they can write as a C, it is dangerous to the health, so do not take as a internally, it causes the poison. So microorganism also, some microorganisms also very very responsible for causing the poison to your body. And snake venom, nothing but the biting of the snake, that also produces the poison in your body. And the drugs also aspirin, paracetamol, benzodiazepines, ssri, nothing but the selective serotonin reuptake inhibitors, anticonvulsants, and the non-steroidal as well as the analgesic drugs also producing the poison, but when if you are taking the overdose rather than the prescription. Now, antidotes. Now, once you cause the poison, then how to treat, how to recover, how to remove the poison from your body? So, nothing but the antidotes agents are used. So, what is mean by the antidotes? Every time they will ask the question in exam, define poison as well as the antidotes and give it example also. Then you have to write down the definition of the poison. You have to give the sources. Then what is antidote? You have to give the definition and some examples also you have to write. So what is the antidotes? What is mean by the antidotes? So those are the substances which are used in the treatment of the poison as well as to remove the toxic substances from your body. Those are the agents used, that is called as a antidote. See, as antidote is a substance that can counteract a form of poisoning, so that is nothing but the antidote. Very simple. Keep in mind what is antidote, which are used for the treatment of the poison. Those agents are used for the treatment of the poison as well as to remove the poison from your body. Those agents are responsible. That agents are nothing but the antidotes. So actually this is a antidote is a Greek word, nothing but the antididonia, nothing but the it given against, म्हणजेच poisonच्या against what they are giving antidotes, nothing but to treat on a poison, to remove the poison from your body as well as to stop the severe effects. Whatever you are after taking the poisons, whatever occurring the serious effects, that you have to prevent. For that purpose those agents are used, nothing but the antidotes. In a one line, those agents which are used in the treatment of the poison as well as to remove the poison from your body, that those agents are used, nothing but the antidotes. You have to prevent. So see, poison plus antidote, what they will do, they are going to destroy the poisoning. This is all about the antidotes. Next one is the classification of the antidote. So, what is the classification of the antidotes? Mainly, antidotes are classified into the three types. First one is the physiological antidotes, next one is the mechanical antidote, and last one is the chemical antidotes. So, what is the physiological antidotes? Antidote म्हणजेच काय? Those are the agents which are used for the treatment of the poison. सो मग कुठले कुठले आहेत? फिजिओलॉजिकल एक आहे, मेकॅनिकल आहे आणि केमिकल आहे. व्हॉट इज द मेकॅनिझम ऑफ physiological antidotes? Nothing but they can directly act on the physiological effects of the poison. म्हणजेच काय? फिजिओलॉजिकल अँटीडोट्स कधी देतात? Whenever that poison enter to your blood circulation, that time what they will give? They will give the physiological antidotes, because easily can directly, nothing but directly they can act. Already it's entered into your blood circulation, so it is a severe case of your body. So nothing but that time you have to give the physiological antidote. So which are act as an antidote? Nothing but the sodium nitrate. What they will do? Just you have to keep in mind what is physiological antidote, and you have to give the example. For this I give for the deep only. So what is the just what is the example of the antidote physiological? Nothing but the sodium nitrate act as a physiological antidote. So how? See, sodium nitrate converts the hemoglobin to methemoglobin. For nothing but for what purpose? To convert the more toxic cyanide to the less toxic, nothing but the active to the inactive form. So mainly these physiological antidotes as well as the chemical antidotes are used in the cyanide poisoning, to treat the cyanide poisoning. Cyanide is the drug which is very harmful to your body and it giving the very immediate effect. Whenever if you are taking the orally, what very within a fraction of second they are giving the very serious effects on your body. For the treatment of the cyanide poisoning, you have to use the sodium nitrate as well as the sodium thiosulfate. What the sodium nitrate works? Nothing but that they can convert the toxic cyanide to the intoxic cyanide, nothing but the toxic cyanide to the less toxic, nothing but the active form of the cyanide, it converts into the inactive form and they can cure the cyanide poisoning. So these physiological antidotes, when it occurs, when it gives the effect, when that the poison is enter into your body, nothing but the when it enters into the blood circulation, that time for the treatment, for to remove the poison, for that purpose you have to give the physiological antidote, nothing but the example is the sodium nitrite. Next one is the mechanical antidote. What is the role of the mechanical antidotes in your body? What it prevents the absorption of the poison into the body. What they will do, mechanical antidotes, it prevents the absorption of the poison into the body, nothing but the mechanical antidote. काय करतात ते, बॉडीमध्ये ते पॉइझन ऍब्सॉर्बच होऊ देत नाहीत. कुठले अँटीडोट? मेकॅनिकल अँटीडोट. बट वन कंडिशन इज देअर, मेकॅनिकल अँटीडोट यू हॅव टू घेऊ विदिन 30 मिनिट्स आफ्टर टेकिंग द पॉइझन. म्हणजे पहिल्या 30 मिनिटातच दिलं पाहिजे. जेव्हा एखाद्या पेशंटनी किंवा जेव्हा एखाद्या मेल पर्सननी, कोणीही, जेव्हा एखाद्या पेशंटनी जर पॉइझन घेतलं असेल, टू रिमूव्ह द पॉइझन, फॉर दॅट पर्पज यू हॅव टू गिव्ह द मेकॅनिकल अँटीडोट. पण कधीपर्यंत? विष घेतल्यापासून 30 मिनिटापर्यंतच यू हॅव टू गिव्ह द अँटीडोट. then only they can stop the absorption of the poison into the body, otherwise that the poison will enter into the blood circulation. जेव्हा पॉइझन तुमचं ब्लड मध्ये एंटर होतं तेव्हा तुमच्या पूर्ण बॉडीमध्ये ते स्प्रेड झालेलं असतं. फॉर दॅट, टू अवॉइड दॅट एव्हरीथिंग, यू हॅव टू गिव्ह द मेकॅनिकल अँटीडोट विदिन first 30 minutes. Within the 30 minutes, if you will give the mechanical antidote, what they will do, मग ते तुमच्या शरीरामध्ये विष पसरत नाही आणि ते त्याचे सिरियस इफेक्ट ऑकर होत नाहीत. टू अवॉइड एव्हरीथिंग, फॉर दॅट पर्पज यू हॅव टू गिव्ह द मेकॅनिकल अँटीडोट टू दॅट पर्टिक्युलर टाइम. सो ॲक्टिवेटेड चारकोल ॲक्ट ॲज अ मेकॅनिकल अँटीडोट. मेनली activated charcoal act as a mechanical antidote. What they will do, nothing but they can absorption by means inactivate and precipitate the toxic material by insoluble salts and preventing their absorption. काय करतात ते? सालचं प्रायर म्हणजे चारकोल काय करतं? व्हेरी सिंपल. ते चारकोल काय करतं, जेव्हा तुमचं पॉइझन दिलेलं असतं, जेव्हा तुम्ही चारकोल घेता तेव्हा काय करतं, दे कॅन ॲब्सॉर्प्शन, म्हणजे कसं ॲब्सॉर्ब करतं, तुमच्या ज्या बॉडीमधल्या पोर साईज असतात त्या पोर साईजला ट्रॅप करतं आणि काय करतं, ते पॉइझन ॲब्सॉर्ब करून घेतं आणि काय करतं, त्या बॉडीमध्ये ब्लडमध्ये ते एंटर होऊ देत नाही. अँड सो प्रिव्हेंटिंग देअर ॲब्सॉर्प्शन, बिकॉज ऑफ दॅट they can reduces the poison effect, they can remove the poison from your body. So this is the mechanical antidotes. Just keep in mind what is the mechanical, prevent the absorption of the poison into the body. Example is nothing but the activated charcoal. कसं ऑकर होते? Don't mind, just you have to keep in mind what is mechanical antidote and what is the example. Example is the activated charcoal. And only one condition is there, mechanical antidote you have to give the within 30 minutes after taking the poison. Next one is the chemical antidote. What is the chemical antidote? In name only, they can change the chemical nature of the poison, converts the toxic to intoxic, converts the systemic to non-systematic. So nothing but the acts by changing the chemical nature of the poison. Example is nothing but the sodium thiosulfate as well. So sodium thiosulfate act as a chemical antidote for conversion of the systemic toxic cyanide to the non-toxic thiocyanide. See that the sodium thiosulfate as well as the sodium nitrite, both antidotes are used in the treatment of the cyanide poisoning. Mainly the sodium thiosulfate and the sodium nitrite, these are the two very important drugs which are used for the treatment of the cyanide poisoning. Physiological काय करतं? Sodium nitrite काय करतं? They can convert the toxic to non toxic मध्ये. इथं काय करतं? Chemical antidote for systematic to sodium thiosulfate causes the conversion of the systematic toxic to non-toxic thiocyanide and they prevents the cyanide poisoning to occur the serious effects on your body. This is the all about the antidotes. First one is the physiological, directly act on your body. Then mechanical, prevents the absorption of the poison into the body. Chemical, acts by changing the chemical nature of the poison. For physiological example is the sodium nitrite, mechanical activated charcoal, and the chemical is nothing but the sodium thiosulfate. This is the all about the poison. Then antidotes and the types of the antidotes. Now, which are the most commonly antidotes are used for the treatment of the poison? First one is the for cyanide poisoning, sodium nitrite as well as the sodium thiosulfate, and the universal antidote nothing but the activated charcoal. See, sometime in questions they will, in exams they will ask the question, why activated charcoal called as a universal antidote? Why it is called as a universal antidote? Nothing but the why, because charcoal is, it can be easily available, it is cheap, it having a cheap price, and they having a higher effect. Nothing but the directly they can prevent the absorption of the poison into the body, but if you will take the within 30 minutes. So activated charcoal, why it is called as a universal? Current, it is easily anywhere, it can be easily available. Next one, it having a very low price, nothing but the cheap, and it prevents the absorption of the poison into the body. For that purpose it is also called as a universal antidote. So now, which are the inorganic antidotes we have to study? See, in cyanide poisoning, sodium nitrate and the sodium thiosulfate. In our syllabus, we have to study only the activated charcoal, sodium nitrate as well as the sodium thiosulfate. Other also inorganic agents are there which act as antidotes. Nothing but the for the treatment of the lead poisoning, you have to use the sodium calcium editate as well as the dimercaprol. It's very important questions. Every time in GPAT also they can ask the question on a this poison as well as the antidotes. So mainly which are the inorganic antidotes? Nothing but the activated charcoal, sodium nitrite, sodium thiosulfate as well as the sodium calcium editase as well as the dimercaprol. These are the inorganic antidotes which are used for the treatment on the poison as well as to remove the poison from your body. This is all about the introduction of the poison as well as the antidotes. ऑल ऑफ यू गॉट? सर्वांना समजलं का?
Yes,
Yes,
ma'am.
ma'am.
Okay, here we will stop and next time we will continue the actual inorganic agents, nothing but the activated